Welcome to a presentation about meniscus tear brought to you by your neighborhood doctors. Please remember that we will cover the topic in general terms. Please consult your doctors for specific questions pertaining to you. An analogy for a meniscus tear is like a paperclip that has been bent too many times. The paperclip is still functional, but it's not as strong as it used to be. Similarly, the meniscus is a cushion of cartilage between the thigh bone and shin bone that helps absorb shock and provide stability to the knee joint. When it's torn, it can't provide the same level of support and stability as before, making it more prone to further injury. A meniscus tear is a common knee injury that can cause pain, swelling, and difficulty moving the knee joint. Common symptoms of a meniscus tear include pain in the knee joint, especially when twisting or rotating the knee, a popping or clicking sensation in the knee, swelling and stiffness in the knee joint, difficulty straightening or bending the knee fully, a feeling of instability or giving way in the knee joint. Meniscus tears are common injuries that can affect people of all ages. However, they are more common in certain age groups. Children and adolescents are particularly prone to meniscus tears due to their active lifestyles and the fact that their bones and muscles are still developing. As a result, they may be more likely to suffer from a meniscus tear if they participate in sports or other activities that involve sudden changes in direction or jumping. Adults between the ages of 20 and 40 are also at an increased risk for meniscus tears due to their active lifestyles. This is especially true for those who participate in sports or activities that involve sudden changes in direction or jumping. Older adults over the age of 40 may also be at an increased risk for meniscus tears due to age-related degeneration of the cartilage in the knee joint. This can make it easier for them to suffer a tear if they participate in activities that involve sudden changes in direction or jumping. A meniscus tear is a common knee injury that occurs when the meniscus, a rubbery, C-shaped disc that cushions the knee joint, is torn. The most common cause of a meniscus tear is twisting or turning the knee while bearing weight. This can happen during sports activities such as running, jumping, or pivoting. Other causes of a meniscus tear include direct contact or collision with another person or object, degenerative changes due to aging, and overuse of the knee joint. Treatment for a meniscus tear depends on the severity of the injury. In some cases, rest and physical therapy may be enough to help the knee heal. This may include exercises to strengthen the muscles around the knee, as well as activities to improve range of motion and flexibility. In more severe cases, surgery may be necessary. During surgery, a surgeon will repair or remove the torn meniscus. Depending on the extent of the tear, a surgeon may be able to repair it with sutures or staples. If it is too damaged to repair, they may need to remove it completely. After surgery, physical therapy is usually recommended to help restore strength and range of motion in the knee joint. In some cases, medications such as non-steroidal anti-inflammatory drugs, NSAIDs, can be used to reduce pain and swelling associated with a meniscus tear. Corticosteroid injections can also be used to reduce inflammation in the knee joint. It is important for patients with a meniscus tear to follow their doctor's instructions for treatment and rehabilitation in order to ensure that their knee heals properly and that they can return to their normal activities as soon as possible. The prognosis of a meniscus tear depends on the severity of the injury and the type of treatment you receive. In most cases, a meniscus tear can be treated with rest, ice, compression, and elevation, rice, and physical therapy. With proper treatment, most people can return to their normal activities within 4-6 weeks. In more severe cases, surgery may be necessary to repair or remove the torn meniscus. Surgery is usually successful in restoring full function to the knee joint. However, it may take several months for a full recovery and return to normal activities. In some cases, a meniscus tear may cause long-term problems such as chronic pain or instability in the knee joint. If this occurs, additional treatments such as injections or braces may be necessary to manage symptoms and improve function. Thank you for listening to this presentation brought to you by Talking Raymond. For information, check us out retinali.com/info. Be safe. Love you.